Microneedling, face, after breast augmentation revision. My body did not take extremely well to my implants. First time, lateral displacement. Second time, implant bottom out on one side and folded down the middle on the other. Third time has been a charm, and I'm so grateful to my doctor. I would like to get microneedling done on my face, and will ask my surgeon next week, but wondering about opinions on whether it's too soon to do anything somewhat traumatic to my body, as I am still healing, 1.5 months out. I tend to get very inflamed. Thanks.
Thank you for your question. You're asking a question where you want to know if it's safe to do microneedling on your face about a month and a half after the third revision surgery related to your breast augmentation. And you stated that the first time you had a lateral displacement, second time it bottomed out, and the third time things are working out. And you're concerned about the stress impact on your body, and you state in the end of the question that you have a tendency to get inflamed. So I can certainly discuss with you the general overview I have of a situation like this. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I perform breast augmentation as well as facial procedures such as microneedling, and I can help you at least understand what the two issues are and whether or not there may be some interrelationship. So to begin with, when it comes to the actual surgical procedure that you underwent with the breast augmentation and the issues with displacement, there are factors that are different from how your skin responds to the effect of microneedling. The surgery of breast augmentation, whether it was a subglandular placement versus a subfacial placement. I mean, there are a lot of other things that have to do with the breast augmentation and the way the implants ended up displacing or coming or shifting downward. Those have to do with a surgical plane that's deeper in this under the skin. So in terms of the question about whether or not to do microneedling, I would say that you are probably comparing apples and oranges. I think that you need to be comfortable. If you have any question and concern about doing this, then you can wait. But I would say that when it comes to the microneedling question, the question I would have is, for what indication? Are you doing microneedling for general skin quality and maintenance? Do you want to just improve some sun damage? Do you want to do something a little bit more aggressive, such as address scars or deeper wrinkles? So the basis of that question would be relatively invasiveness. Microneedling can be done at 0.5 millimeter, or it can be done as much as 2.5 millimeters, which is straight through into through the skin. So you have a range. And in our practice, we combine microneedling commonly with platelet-rich plasma. We use your own blood, and we concentrate the healing and growth factors that will stimulate collagen, stimulate blood supply, improve discolorations. And so we actually apply topically in addition, and it helps fine lines, wrinkles, sun damage. So the question really probably is now is, after undergoing the surgery, are you really up for another procedure? I think that if microneedling was recommended to you, well, ask the practitioner, the physician, what is the purpose and what are the other options, and where does this fit in a more overall program. Microneedling is not just a single procedure typically. You want to do it with some consistency in order to get a good result. That applies to many different cosmetic dermatologic procedures. So I think that If you are a month and a half out and you still feel a little bit just drained from from the breast surgery, then you should probably wait a couple of months till you feel good and maybe do things a little bit less aggressive. In our practice, we actually we do something called hydrofacial, which is this blended version of microdermabrasion, but with the infusion of water and glycolic acid. And in many ways, it helps to improve the epidermis, the top layer of skin, in improving the overall smoothness as well as the color and the luster. So you can kind of get something that's less invasive and still moves you along on the path of improving your skin. So discuss this first with your surgeon, the operating surgeon who did the breast surgery, and then discuss this with, if it's the same doctor or another doctor, discuss this option with the doctor in terms of whether microneedling is the only thing to do. But I think from a scientific perspective, I don't think the two really have that much of a relationship. And in addition, if you say you have a tendency to be inflamed, if your skin tends to fall in the category of sensitive skin, then microneedling probably is not the best choice for you anyway, because if your skin is very sensitive, you tend to respond more aggressively with more redness and more swelling and more discomfort than someone who doesn't have sensitive skin. So that also has to be put into the context of this decision. So I hope that was helpful. I wish you the best of luck. Thank you for your question.